No shortage of health topics these days, and we're talking about now the measles outbreak in Texas. It's now grown to more than 120 cases.
It's the biggest outbreak in the state in 30 years. So let's talk about measles with 9 News medical expert Dr. Kohli. And you know what? This was eradicated, was it not? I mean, you didn't hear about measles. You shouldn't be.
That's exactly right. In 2000, it was eradicated here in the United States. In fact, I have never seen or treated a case of measles personally because I went to medical school after the year 2000. And now it's woken back up. And the reason for that is not the virus, because the virus is very stable. It really hasn't mutated in the last 25 years. It's the fact that we're dropping our vaccination rate. So 95% of the community has to be vaccinated for us to prevent an outbreak. And those numbers have dropped below 93 in places like Texas recently.
With this happening right away, this isn't about RFK Jr. This is about America's appetite for vaccination and the way vaccination has become less popular, if not unpopular.
I would say, Tom, this is really fallout from the COVID-19 pandemic, because before that, we didn't stop to ask, should we get a vaccine? Is this vaccine safe? You know, is our doctor telling us the right thing? And now you've got the measles vaccine, which is 97% effective with 2 doses, had eradicated the disease. And more people are opting their children out of this vaccination, opting themselves out of it, and causing these viruses to wake up. Now, these viruses always lived in other countries, sub-Saharan Africa, in Asia, but now they're getting on a plane and coming to the US because we're not vaccinated. And we're giving up this luxury that we had of having immunity to this really, really contagious, in fact, arguably one of the most contagious diseases.
Does Texas's situation portend it being here in Colorado? Is it inevitable that it will spread?
It is inevitable because there are people here in Colorado that are not vaccinated. Now, I don't know exactly what our rates are here, but if they fall below that 95%, what we call herd immunity, that virus is going to get on a plane and come here. In fact, it's so contagious that every person infected infects 9 or 10 others. And you can go into a movie theater where someone had measles and 2 hours later and still be exposed to it because it lingers in the air and it's airborne. And you can be contagious with measles before you start presenting with symptoms. So it's one of those dangerous situations where if we're not vaccinated, if there's anyone here in Colorado or their children are not vaccinated, now is the time to go and get them vaccinated, because even 1 dose is 93% protection.
So when you say that, first of all, I want to know how serious measles are, but I also think of shingles, right? Isn't shingles part of the, attached to measles too?
No, shingles is chickenpox.
Okay, that's chickenpox altogether. Okay,
yeah,
I just want to make sure.
But your point that you're making, Kim, is that measles is one of the most deadly respiratory viruses. This is not an infection to get. This is not just a cold. So it's kind of
like COVID and the flu? It's respiratory?
So it's a respiratory virus. It transmits person to person, but it's also airborne, that it lingers in the air. But it's different from COVID and flu in the sense that it doesn't just affect the old and the young badly. A lot of people can get very sick from it. In fact, 20% of unvaccinated people will end up in the hospital with it, and 3 out of 1,000 kids will die with it. And you're talking blindness, deafness, encephalitis or brain swelling, lots and lots of severe complications from it. Avoidable, and there's no treatment for it. And you can even have a chronic form of measles that can cause seizures and death years later. So this is not something to toy around with. This is one of those viruses that many of us don't take seriously enough because we haven't had to deal with it in the last 25 years. But now that it's here, I would really strongly encourage anyone who's not vaccinated to get so. If you've been vaccinated as a child, like most of us, we have lifelong immunity. There's only 1% of people that are older or, you know, have problems with their immune system that might need to get their titers checked, to get a blood test to check if their immunity is high enough. Now, keep in mind, pregnant women can't get vaccinated, neither can patients who are immunocompromised, because the vaccine is a live vaccine. So we can't give it to some of our people. So it really behooves the rest of us to step up. That's right.
I imagine it's heartbreaking as a doctor and scientist that it's been allowed to make a resurgence, if you will. We'll unfortunately likely be talking about it more. We'll check in with you on our next visit. Good to see you. Thanks as always, Dr. Kohli. You can also find much more with Dr. Kohli. All you have to do is go to 9news.com/Dr. Kohli.